Firing this thing up. All right. Good evening, everyone, and welcome, a very warm welcome to this special edition of the Know Your Pharmacist Livestream. I'm your host, Dr. Joaquin Acosta, and CEO of Pharmtrue. Proudly here to guide you here tonight through an intriguing exploration into the dynamic world of pharmacy, especially as we kick off the National Pharmacy Week, guys. It's not just a profession, but a community dedicated to fostering wellness and advancing healthcare. Tonight, we're diving into a compelling array of segments that not only shed light on the profound impact pharmacists make, but also celebrate the inexorable spirit of our community, guys. It's all about connecting, learning, and growing together as we delve into the heart of healthcare fueled by a common purpose. Our Pharmacist Frontline segment will unveil the essence of Pharmacy Week, spotlighting the indispensable role pharmacists play in patient care. It's the spirit of service and expertise that stands as a beacon of hope and assurance for countless individuals. As we transition into Tech Talk, brace yourselves for a journey into the digital realm where technology meets medicine. A good advocacy video that we're going to show today, showcasing, the strengths of pharmacists and what pharmacists really do. That, if every single hospital in America or everywhere else could have this video up, for their healthcare teams, this would be really, really great in helping continue to revolutionize pharmacy practice in Pharmacy Week here, making it more even efficient, recognized, and accessible. Moving on to that, our Enlightenment Hour is bound to stir thought and admiration as we share the ASHP state proclamation recognizing Pharmacy Week. So they have that for everybody to send out to either their state or local officials to get National Pharmacy Week recognized October 16th through the 21st this week. Testament to the indomitable resolve and contributions of pharmacists across the state celebrating our collective mission. So, if we could get this nationally recognized, we should really continue to push so. And sometimes going through all of your local chapters all the way up through state could be a really, really good way to do that. As we venture into the Herbal Wellness Corner, let's unravel some fascinating facts about THC excretion, a blend of curiosity and knowledge, paving the way for broader understanding and acceptance. Our community spotlight is a tribute to the adrenaline rush of the 23rd annual Rancho Milagro Fall Nationals over at Vado Speedway Park, about community excitement and the pure joy of living in the fast lane, embodying the essence of camaraderie and thrill, guys. In our Men's Health Minute, lastly, we shed light on seasonal affective disorder. Might be about that time of year, unraveling insights to foster awareness and support. It's about nurturing mental health during Mental Health Month with empathy and expertise. Let's embrace this voyage of discovery and engage in fruitful discussions, fostering a community of engagement and care. Together, guys, we are not just learning, we are building bridges towards a healthier and happier society. Thank you for joining me on this enriching journey. Now, without further ado, let's delve into the heart of tonight's episode, shedding light, spreading love, and catalyzing change. Your engagement, guys, is not just welcome, it's cherished. So let's make tonight another memorable episode of the Know Your Pharmacist Livestream, sharing with you guys right now the essence behind National Pharmacy Week and the history of it. So let's go through the timeline. And again, right above here, next to me in the QR code, the ASHP proclamation. If you click that, you will get linked over to, and we'll show it later, the ASP proclamation that you can submit to your local officials or state officials to get National Pharmacy Week recognized. I think it's cool. Maybe I'm a little biased, but anyways, showing you guys the Pharmacy Week timeline here. So 168 BC, and this is according to, National Today. This was a appreciation article that came out today, and I did like, the history breakdown that they gave with the little timeline. Again, guys, pharmacists have been doing this for a long time, whether or not whatever the recognition of, but check this out. 168 BC, prehistoric prescriptions, early medical prescriptions are discovered at the, I don't even know how to pronounce it, archaeological site in China, right? In 1240, making it clear, the King of Sicily, Emperor Frederick II, issues a decree separating physicians and the apothecaries, professionals, pharmacists, right? One man, one mission, 1925. Pharmacy Week is celebrated for the first time after Robert J. Ruth, a pharmacist from Asheville, North Carolina, proposes the National Pharmaceutical Week at the American Pharmacists Association annual meeting. So since then, right, 2014, from a week to a month, the American Pharmacists Association declares the entire month of October American Pharmacist Month. Awesome, right? But this is National Pharmacy Week, so we do have to thank Robert J. Ruth back in 1925 proposing this for the first time. And again, the American Pharmacists Association, APHA, is still very relevant and alive today. It's a very important organization in terms of defining our pharmacy history, our pharmacy collective thought, and so on and so forth, because the industry of pharmacy is so well ranged, right, guys? Not just from hospital and retail, and then you're looking at all the other different lenses of pharmacy and pharma, that's all out there. And the apothecary, the ancient, right, kind of technique there is still, again, very, very practical as of today, because what do people receive from their pharmacist, right? Not only according to some of this article, which is really good, because yes, not only medicine to patients, but also essential information, guys. What do you do when you call the pharmacy, whether you're a nurse, whether you're a doctor, whether you're a patient, right, or a caregiver? You're going to ask for information and essential information on medication that you need, the gatekeepers of the drugs that are holding it with, safety in mind, safety coming in, safety going out, right? And to literally do that, yes, is a very, very fine, perfected art that is different and separate from, again, doctors. And we all understand that. It's not like anything that we necessarily have to fight for in that regard today, but where we're at should continue to advance that role of not only the pharmacist, but every other healthcare provider as we continue to move into new realms of healthcare, new realms of technology and innovation, and all this stuff is going to continue to happen. So, where pharmacists have rights right now to do things like administer vaccine, prescribe vaccines, right? They can, here in the state of New Mexico, do things like tobacco cessation, birth control, and that's not every single state, right? So again, the prescriptive authority, for pharmacists continues to evolve. It's very interesting when you do look at a lot of things like, where primary care is, where urgent care is, the way a pharmacy is already just within the nature of the business. I think in terms of the efficiency of healthcare and the system, you're going to continue to see more and more of an evolution here in the role of the pharmacist and the pharmacy and pharma, just kind of in everything there when it comes to health. And again, guys, I think National Pharmacy Week is a great time to talk about it, but each and every single day you're working with your pharmacist for whatever it may be when it comes to your meds. And should you know how to do it and should you know why? Absolutely. But we will continue to teach, advocate, and empower you guys to talk to your pharmacist and use, that knowledge wisely. So I'm going to show you guys next here this little video from the American ASHP here. And I like it because, promoting the history of Pharmacy Week and everything there, it's just an important, little compass for where we're at, because, looking at pharmacy and where people really understand the role of pharmacist, I think we are still trying to, continue to evolve that, to grow that, to learn that. And so that's what I'm going to share with you guys here in this video is, from ASHP, promoting the fact that, hey, pharmacy really, really should be even that much more advocated for, should be understood, how to work with pharmacists. Like if this video was posted up in every hospital, it'd be a very, very critical thing if you look at this. So again.
When you're sick, you can see a lot of people in white coats. Some are doctors, some are nurses, and some are pharmacists. Pharmacists are the members of your healthcare team who are experts in medicine. And by experts, I mean experts. We're talking 6 years in college studying how medicines can best help you. It's called a PharmD, a Doctor of Pharmacy degree. But it doesn't stop there. Many pharmacists have extra training and specialize in caring for people who are critically ill, children, and people with cancer. That's a lot of expertise that really pays off, because with pharmacists on your healthcare team, you get better care. Pharmacists help doctors choose the best medicine for your individual needs and work with you in many ways. They'll talk to you about your medicines and how to use them safely. They'll review all the medicines you may be taking, whether prescription or non-prescription, to make sure they work well together. And they'll help you manage health conditions, like diabetes and heart disease. Pharmacists also give vaccinations to help protect you from illnesses like the flu and shingles. You can find out more about the medicines you take at safemedication.com, a website developed by ASHP, the Association of Pharmacists who take care of patients in clinics, hospitals, and other healthcare settings. There's lots of helpful information, including tips about how to use your medicine safely. So next time you are in a clinic, hospital, or other healthcare setting and see someone in a white coat, ask if they are your pharmacist.
So super cool, right? I think, understanding the role of the pharmacist in the healthcare team should really be, continuing to evolve. And by doing things simply like sharing, right, that video or that resource that I put there in the chat comments, guys, could, maybe really change perspective for one person, whether it's one provider, one, caregiver, one nurse, one patient. You never know. Somebody can work their pharmacist and work with their pharmacist just a little better. And learning that through National Pharmacy Week, geez, that's a job well done. That's all that matters. Again, moving on, guys, strategies for success. Following up on the ASHP website here for promoting National Pharmacy Week. I put this in the link as well, just how to get to that page. Again, I like trying to think of it as a collective whole, because whether you're a student, whether you're working for a pharmacy, whether you own something in pharmacy world, whether you're right just on the nonprofit side or wherever that might be, everybody does align around these things like National Pharmacy Week. And where can people get involved? Moving on to our segment here of Enlightenment Hour, I'm showing you guys the National Pharmacy Week state proclamation and how to submit it. So, being a little late this year, maybe we won't have it on our New Mexico calendars this year, but into next year, guys, I think it's very important to continue to look at, how can we get a little bit more recognition in the pharmacy world? And ASHP already gives you the resources to do so. So, right here on the screen, as you see, request a proclamation from your governor or local elected officials to declare October 15th through 21st as National Pharmacy Week. So what happens, again, when you click this, and this is exactly what I have up in the QR code, right? Takes you over to the Pharmacy Week proclamation form, which I will share with you here. And so again, if you want to get involved, just replace this with wherever it's at nationally for you. Office of the State Governor, State City, proclamation, whereas, right, pharmacists are experts in successful use of today's complex medications, and patients in hospitals and outpatient clinics receive better care when pharmacists are directly involved in medication management decisions, right? And whereas pharmacists' direct involvement in patient care helps reduce unnecessary costs and burdens to the health system, and whereas pharmacists and pharmacy techs practicing the acute and ambulatory care settings of, Las Cruces, New Mexico, for instance, contribute to the health and wellness of our citizens, right? Boom, boom, boom. National Pharmacy Week. Get something proclaimed. If you guys want to advocate and be on the know for all that, that's exactly where we are at in sharing this right now, and want to make sure everybody does have, the resource of how to click in and submit and, be a part of all that. So thank you. Happy Monday. Happy start of National Pharmacy Week, even though I guess it technically started yesterday. So either way, guys, looking at this, moving on to a little bit of new information here. Well, some pretty cool stuff. And this is something I found from a pediatric pharmacist, actually on LinkedIn. And I think it was a very interesting take here because, again, I hadn't known that this was fully a thing yet. So I'm going to share this with everybody if I can. Excuse me. All right, it's coming up. Oh, it's not going to read very good, but again, just so you guys can see above me, and I'll look up some other information, but I did want to give credit where credit was due because I like the way this pharmacist put it. And this is Cody Peterson, Dr. Cody. He's a pediatric pharmacist. He works for Canigma. It's a cannabis company. So that's very cool. But anyways, his take here, did you know that most THC is excreted through poop, not urine? That's right. An extract from your feces could technically get you high. In fact, 2/3 of all THC leaves the body via feces, mostly as 11-hydroxy-THC, but as unchanged THC. The only THC metabolite found in urine is 11-carboxy-THC, which is not psychotropic and not indicative of recent use. Starting January 1st, 2024, California employers will no longer screen for 11-carboxy-THC as a pre-employment drug test. It's the law. Employers can only look at psychotropic cannabinoids as an indicator of recent use, which will greatly reduce the stigma associated with cannabis use. So, again, testing is going to have to continue to change there, guys. I want everybody to really, really understand that this industry is going to keep changing, and where California already, starts some things about pre-employment testing, changing in general. The future is still going to be very, very interesting when it comes to how that's going to get evaluated, so on and so forth, right? But starting January 1st in 2024 in California, they're setting a new precedent, that's for sure. So moving on to the next thing, guys, talking tonight. Where am I going to be all weekend long? You already know, Vado Speedway Park. It's the 23rd annual Rancho Milagro Fall Nationals, and it's going to be a freaking blast. It's going to be some great racing, guys, and want to make sure everybody already gets the heads up for that today. Sharing that right below here. I mean, you are going to see some sweet racing for 3 days, and the first 1,000 fans that come Friday, courtesy of Rancho Milagro, will be free, and that's very awesome. So again, get there a little early to seize that. These drivers are going to be racing for $20,000 to win on Sunday in the A-Mod class. The A-Mod's very fun to watch, but all the cars that are going to be there, it's going to be some intense competition, and it's going to be a really, really good time. So guys, get those tickets now tonight. VadoSpeedwayPark.com. Go check it out one of the 3 days, Friday, Saturday, or Sunday this weekend. If you can't go to all of it. But for those of you who will be, living there, I'm sure you guys already know, right? So that's for sure. Anyways, put VadoSpeedwayPark.com in the notes there so everybody understands where you got to be to see some really good racing. We'll be calling the interviews there. Trey Brubaker is going to be calling the races, and that's going to be awesome, awesome day. So lastly, everybody, moving on to Men's Health Minute tonight. I want everybody to kind of get sharing the last thing here. An interesting read for men and women, but again, interestingly enough here, right? How do you know if seasonal affective disorder may make you feel down or if you may be apt to it, right? Now the seasons are starting to change a little bit. You can feel it in the air. The sun's going down earlier, so on and so forth. So again, some people, men and women, will naturally, go into a seasonal affective, depression disorder, right? So, what is it, right? Some people think about it, right? Again, it is, appropriately abbreviated as SAD, a subtype of depression that begins when the seasons change, right? So looking at and revealing how this, may actually come about and may be present in your life, I think it's a good thing to be aware of for not only young, men and women, but, people get cold, and that can cause it. The sun and the vitamin B, where is that going to cause it? And it affects everybody differently. How else can, people battle and take some tips to, try to, combat that. Again, sometimes, community, getting active, trying to be outside, finding hobbies in the time wherever, whatever time changes that may be happening that do not fix these things, seeing friends and family, just talking it out in the hallways, right? But again, there's national hotlines that we want to make sure everybody can know that is available out there for people. Putting that one up here right now. Again, the Substance Abuse and Mental Health Services Administration has a national helpline, 1-800-662-HELP, 4357 for anybody, that could be in a crisis, or again, texting 988 for some intense amounts of emergencies and things there. But, just want to make sure that everybody's aware that sometimes these things exist. Sometimes making sure that you go out, get that sun, get that vitamin D, and try to curb whatever other seasonal affective things that may be, ingrained in your just habits, right? Could be hard to shake. So I guarantee you won't be depressed if you're over at Vado Speedway Park Thursday, Friday, and Saturday this week. That's what I'm telling you right now. Anyways, much love to everybody. Hope everybody's had a good, happy Monday so far. And we'll see what's going on in the football world tonight. If you guys are watching the Cowboys, we'll see. Go Cowboys, right?